tonight.
I'm a pretty easy, low-key person, so I was at home with my wife and a couple of friends.
We welcome another new year together.
It was the first time in a long time that I had an opportunity to get my whole family back together.
3, 2, 1, Happy New Year!
I did get a phone call from my colleagues at CDC that there was a mysterious new pneumonia.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
Both of us agreed that this looks, smells, and almost certainly is a new coronavirus. And the question is that what are we going to do about it? It is the perfect storm and my worst nightmare.
When there's a new pathogen like this, the CDC sets out to develop a test.
That's routinely what we do, and we do it very well, which they did, and they did it in record time, 7 to 10 days.
They immediately came across a problem. One of the components of the test was essentially invalidating the results.
And so the CDC then had to send out a second batch of test kits, which also had a problem. And as the weeks ticked by, we were running out of time to contain the spread of this virus, and we knew it.
It took us about close to 4 to 5 weeks to figure out the contamination, and within 5 weeks, we got the test to the health departments throughout the nation, which I would still say is pretty record time.
Hi, can I see who's the patient?
Let me be very clear. In an outbreak scenario, every day matters. Every hour matters. So losing months meant that our chances to contain this virus were gone.
This was pretty much the most critical time in the outbreak for us to be flying blind. And the virus was seeding America, and sadly, lives were lost.
CDC doesn't develop tests for all of clinical medicine. I do think the private sector wasn't quite all in developing a coronavirus test back in January and February. But I think in retrospect, if it had been stimulated more, it would have been a great benefit. I don't think CDC will manufacture tests in the future. I think what we'll do is we'll contract a manufacturer to manufacture the test.
The testing facility here outside Hard Rock Stadium just opened up. It now stretches nearly 2 miles long.
There's an infinite demand for tests right now. I think if you asked 100 million Americans if they wanted a test, they'd say, I want a test right now. The reality is we went from 0. We're probably going to do 25 or 30 million over the next 30 days. But I'm not satisfied. And we should all not be satisfied because we still have a long way to go.
And yes, there's been mistakes. If I got too preoccupied with the critics right now, it would be paralytic.
We need to do better, and we're going to do that.